you test your fertility, the female fertility is assessed by looking at the ovarian reserves, the ovulation, and checking for the fallopian tubes. The ovarian reserves can be assessed by a combination of blood test and the ultrasound scan. The blood test involves checking for the anti-Mullerian hormone or AMH. It includes follicle stimulating hormone or FSH levels. It is usually done in a combination with the estrogen or estradiol levels to reach a valid result. The ultrasound involves measuring for the very small follicles or what we call as an antral follicle, and this count is known as an antral follicle count or AFC. So the ovarian reserve assessment is done by a combination of these blood tests and an ultrasound scan to understand the full picture. Next, moving on to checking for ovulation. The ovulation is generally tested by measuring progesterone levels. This is done a week before the expected period. Generally, it is known as a day 21 progesterone test because it's presumed that every woman has 28-day cycle, which is really not the case. Checking for the fallopian tubes involves doing tests like hysterosalpingogram or hycosi, or sometimes gynecologists may recommend doing laparoscopy and a dye test, which is also known as lap and dye. Hysterosalpingogram and the hycosi are the outpatient procedures. They are screening procedures and are the first step that you would have to undertake if you're trying to assess basic fertility of the woman. These tests involve undergoing a gynecological procedure very similar to the smear test. A catheter is placed into the womb cavity or the uterine cavity. A contrast dye or a medium is instilled, and this dye fills through the tubes and spills from the far ends of the tube. And this filling and spilling confirms the patency of the tubes. These are outpatient procedures. They may be a little bit uncomfortable. Going through a laparoscopy or lap and dye is a keyhole surgery. It involves a day surgical procedure for which you will put to sleep. You may have to take a couple of days off, and yes, the recovery period can be a few days to a week. However, it is recommended for patients where there may be coexisting factors, risk factors for infertility, such as endometriosis or a past history of a chlamydia infection or pelvic inflammatory disease. So assessing for ovarian reserves, ovulation, and the fallopian tubes forms the basic assessment of a female fertility.